Hello again. There can be no doubt at all that black people in London and in Britain generally tend to have a worse lookout for their health than the average white person. Lower life expectancy, more complications during pregnancy, more heart attacks, diabetes, high blood pressure, cancer of the prostate, all kinds of other things. This was particularly noticed during the COVID business that black people seem to be more at risk than white. The same thing was observed too in the United States, and there were ominous mutterings that all this was indicative of some kind of systemic racism in the medical profession, which placed a higher premium on white life than it did on that of black people. I have been prompted to think about this because I read an article in this week's New Scientist and then shortly afterward received an email which gave me a cut and paste document pulled from the internal internet service of Barts Hospital in London. I'm afraid I can't give a link to this because I don't have access to Barts intranet. Someone there supplies me with bits and pieces of information that I might find useful from time to time. I'm going to read out and quote from it. I've cut and pasted it into the description to this video so readers can see for themselves what I'm talking about. It's dated October the 18th and begins as follows. Barts Health NHS Trust are working to increase participation of people from black communities in their research after data showed that only around 1 in 50 people involved in their COVID-19 vaccine clinical trials were of black heritage. While this figure is higher than the national average, given that 1 in 5 of those the trust serves are black, Caribbean or black African, much more needs to be done to ensure true representation in research. It's not only COVID which is being researched by places like Barts, of course. There are all sorts of other things, including cancer of the prostate, to which Caribbean men are especially prone, and also, as I say, high blood pressure. The document continues. Dr. Vanessa Appiah, a Barts Health consultant in sexual health and HIV and honorary lecturer at Queen Mary University, said, "Underrepresentation of black communities in research isn't something new, but having this solid data, thanks to rigorous record taking, confirms our long-held speculation that the proportion of individuals from black communities taking part in our clinical trials is too low, and we need to fix it." The pandemic shone a new light on some of the reasons people from these communities are reluctant to take part in research. Varied and complex, they include mistrust, deep-rooted hesitancy, socio-economic barriers, and lack of adequate engagement by the research community. Unless action is taken to address them, the research community and wider public can't be confident that the treatments, vaccines and tests being developed will benefit everyone. Ensuring adequate representation of people from black communities is particularly important when studying diseases which disproportionately impact these communities. Diseases like COVID-19 and hypertension. Hypertension is high blood pressure, by the way. Now, I have no idea what deep-rooted hesitancy means, nor do I know how socio-economic factors would prevent a black person from being part of a research project. They don't have to pay to take part, and it doesn't matter whether they're working class or middle class, so I'm puzzled about this socio-economic aspect. The bottom line is that just as with donating blood, volunteering for charities and various other enterprises, which involve giving time and other things for nothing, taking part in medical trials and research projects is not something black people go a bundle on, to use a colloquial expression, even when, as in this case, their own ethnic group would be the chief beneficiary. In The New Scientist today, which came out today, I should say, we see this piece on the take-up of childhood vaccines. It says childhood vaccine uptake in England varies with ethnicity. Without debating the efficacy or wisdom of COVID vaccinations, I know a lot of people think that they're part of a sinister conspiracy, but I'll just overlook that for a moment. The data show that 83% of children of Chinese origin have had at least one dose of the COVID vaccine, but just 16% of black children. White kids fall in the middle. Interestingly, this is the same gradient we see elsewhere in many different contexts when comparing ethnic groups in Britain, with Chinese at the top, black people at the bottom, and white ones somewhere between the two extremes. I've talked before about this particular gradient and how we see it in academic achievement, socioeconomic status, various other things. I'm intrigued by all this because an expert quoted pops out the usual hints about racism and health. We see here, in terms of the inequalities, it's not really surprising that people in deprived areas and ethnic minorities are getting less care than others, says Michael Absood of King's College, London. That's been the history of health. Well, black people are not receiving less care than others at all. Indians and Chinese are also ethnic minorities, and by this measure they are receiving more care, so that's a lot of nonsense. I have a strong suspicion that at least part of the reason why the health of black people in this country is less robust than that of white people is because there is a tendency to avoid putting themselves out for others by donating blood or sacrificing their time to take part in medical trials and so on, or leaving their organs. Even in death, they seem reluctant to do something for other folk. I'm not speaking generally now. I'm not making an absolute statement. I'm saying that black people as a whole are less likely to leave their organs to medical science and to benefit others than are white people. It just happens to be a fact. It's all very well claiming that Black Lives Matter, but the way to prove that is for black people to sacrifice their time for medical trials and to take part in research. This would save a lot more black lives than anything else which they might do.